One of the most common things that I asked in my outpatient is about protein supplementation. So today we are going to discuss about whey protein, which is one of the most common protein supplement that me as a doctor prescribe to my patients. So my patients are not your run of the mill patients. They are very highly advanced end stage liver disease patients who are with a lot of complications related to cirrhosis and complications related to portal hypertension, which means these patients have bled, they have fluid filled abdomens, they undergo multiple admissions in the hospital, etc. Some of them even have uh, an organ failure that is not related to the liver. For example, kidney injuries. Some of them have brain failure, something known as hepatic encephalopathy. So it's very important that chronic liver disease patients, like chronic kidney disease patients, uh, get their proper protein intake in their diet on a daily basis. But they cannot eat so well like a normal person. So supplementation is very important. So the whole myth that waste supplementation is actually harmful falls flat here because we are providing whey supplementation to the sickest cohort of patients, which is advanced liver disease patients. So whey supplements or whey protein is basically milk protein. It's the most natural thing that you can actually have in its best form. So milk protein has two components to it, mostly. That is casein, which is about 80%, and whey protein, which is about 20%. So whey is the most digestible part of milk protein, and it's quickly digested. It gives a sudden influx of amino acids into the body, which means for people looking at improving lean mass, reducing muscle breakdown, for example, these patients with liver disease, whey protein is a fantastic substitute as a protein supplement. Now, the whole fear mongering about whey from doctor community itself is very wrong because it's a lot of these doctors who are not aware of nutritional science and how important it is for patients to have protein. They think that whey supplements are made in some chemical factory, and whey supplements are always considered some sort of synthetic formulation that people are making inside factories, and it's only for people who go to the gym or people who go to the fitness clubs, etc. This is absolutely wrong. This is a huge misinformation that is being spread within the community, especially in the doctors community. So whey supplements are natural proteins, they are milk proteins, and they are the most digestible form of proteins that is available for people to have. So I usually supplement either whey concentrate, whey isolate, or whey hydrolysate, depending on how my patients need protein or can tolerate protein. So whey is of three types. The concentrate form is the most common type that you find in the market, which is the cheapest version of whey. It has a little more of fats and milk sugars in it, so lactose intolerant people may not be able to enjoy it as much, which is why we have the other two forms, which is whey uh, isolate and hydrolysate. So the isolate form contains lesser amounts of carbs and fats, and the hydrolysate forms are actually pre-digested, which means they are the most and fastest absorbed type of protein, whey protein available in the market, and they are the most expensive. So hydrolysate proteins are mostly for athletes and people looking to uh, do power sports, or they're bodybuilders or professional bodybuilders, etc. For a common person, whey concentrate is good enough, but somebody who's not tolerating lactose, whey isolate is a better option. I usually prescribe my patients whey isolate because they are more digestible and they tolerate it very well. And the protein content also varies between uh, these kinds of formulations. For example, the highest protein content is in whey hydrolysate, and the lowest is in whey concentrate, which is about anywhere between 80 to 85% to more than 90% in the other forms. So whey isolate is a good middle ground that people can actually use. Now, coming to the uh, aspect of how much safely someone can take. So whey protein is not something that you substitute for a meal. It's not a meal replacement. It's something that you add on to your meals. For example, if a 60-kilogram person needs 1 gram per kilogram per day of protein, total protein, and he is consuming about, say, 40 grams of protein only per day. He is able to consume only 40 grams of protein a day. Adding a scoop of whey concentrate, which is somewhere around 20 to 23 grams of protein, would actually help him achieve his target. Similarly, if you are going to use whey isolate, you can actually gain more protein intake with a single scoop. For example, some of the companies have even up to 30 grams, 26 to 30 grams of protein per scoop when it comes to isolate and hydrolysate. So whey protein is a supplement, not a meal replacement. Now, the whole aspect of whey protein being bad for your liver and kidney, it's absolutely wrong. In liver patients, whey protein is supplemented as part of a healthy diet, and this holds true even for patients with very advanced liver disease. So there is no harm in using it. The only harm in using whey protein is if it's mixed with other stuff. For example, you have pure whey formulations and you have blended whey formulations. So be very careful when you buy whey formulations. Please ensure that these are not blended with other types of proteins or other types of herbal supplements. For example, a lot of whey protein supplements come with added curcumin or turmeric, ashwagandha, Garcinia cambogia, which is basically Malabar tamarind. It can come with a lot of other proprietary blends or proprietary herbal extracts. Please avoid these because they are the ones that is truly harming your liver or kidney, not the actual whey. So blended proteins, impure blends. For example, sometimes they can add whey. They'll add soy along with whey. They'll add lots of other types of protein, pea protein with whey. I mean, these are not good quality. You may never get the actual labeled amount in these kinds of blended proteins. Always go for a pure whey, either concentrate, isolate, or hydrolysate. And especially stay away from proprietary blends. Please read the bottle, the whey bottle. If you see something like a proprietary blend or a proprietary extract added to it, please avoid those, especially herbal blends. If you look at the data on protein supplements causing harm to people, it's either they are adulterated or contaminated with anabolic steroids, which is something illegal. Some of these companies have done it and they have been caught, or they have been mixed with these herbal blends. For example, there were major cases of whey supplement or protein supplement related liver injury, liver failure, and liver deaths in the US because of proprietary blends and synthetic blends of herbal supplements into natural protein. So please stay away from these kinds of blended proteins. Otherwise, whey is very safe. It does not injure or harm the liver. Now, coming to the kidney part of it, a lot of people say that whey protein causes increase in kidney stones. It can reduce the liver, kidney functions and worsen kidney functions, etc. So this is also not true. If you look at somebody who's healthy, who's consuming whey protein as a supplement, the natural urge of the kidney, if you take a high protein diet, is to filter the protein off quicker or stronger. So the glomerular filtration rate, which is actually the medical term for the functioning of a kidney, it actually increases. So the increase in this filtration rate because of a high protein intake is not because the kidney is under strain. It's a normal physiological process. So patients with underlying kidney disease, for example, chronic kidney disease patients, you need to talk to your doctor, the nephrologist, and a dietitian, and then tailor your protein supplement intake based on their recommendation for daily protein supplementation, because you don't want to strain a diseased kidney. In healthy people, whey protein supplementation strains the kidney normally, but it doesn't mean that it is actually harming the kidney. So it's fine for you to consume whey supplements. It does not harm the kidney. It does not damage the kidney. Third point is about kidney stone formation. Yes, there are a lot of studies in animals, preclinical studies, animal model studies, hypothetical studies, which claim that presence of whey actually causes increased risk of stone formation in the urine, but this in the kidneys and in the urine, and this has never been proven in humans. So there is no actual data, prospective trial, or even a pilot study, or even a comparative cohort study to actually show that kidney stone formation or worsening of kidney functions or presence of more stones in the urine because of whey protein intake actually exist. These are just fear mongering and hypothetical extrapolations from the non-medical community and also from a lot of people who inherently feel that whey supplements are bad for them. So it's a cognitive bias. And I think a lot of doctors also still believe the fact that whey supplements can harm the kidneys and liver. And I think it's important for doctors to also realize that just by reading the data, you'll understand that you're wrong. And if possible, and if it's needful, patients should be put on protein supplements, and whey protein is the safest protein out there for anyone to have. The third point is which way. The third part of this talk is which way is safe for you, good for you, which are the brands that we need to opt for. So this is something that I would not venture into from a personal point of view, because I don't endorse any brands. I don't get any money by endorsing any brands, and I don't want to do that also, because whatever I say, whatever I do, all the stuff that I talk here is just for public patients and for the general information. But what we did was we have a series of studies that are published on protein supplements quality. So if you know about the Citizens Protein Project, the first one was done a couple of years ago, and the second one was done just last year. We did it differently, the two protein supplement projects. The first Citizens Protein Project was actually looking at labeling and quality of generally sold or popularly sold protein supplements in the Indian market. And we found out that at that time, a lot of these protein supplements were mislabeled, which means if a brand claimed that a scoop of their protein supplement or 100 grams of the protein supplement contained 60 grams of protein, 100 grams of that, the product contained 60 grams of protein, what we identified was that they were lying. It sometimes contained only 20 grams, sometimes even 10 grams. So there was a lot of mislabeling when it came to branding and marketing of these protein supplements in the Indian market. So that is what we identified in the Citizens Protein Project Part 1. And also a lot of these protein supplements also had contamination with lead and arsenic and mercury, etc. Now, an important aspect to note here is that FSSAI, that is our major regulator, so-called major regulator of food and nutritional products in India, they have certain limits for what is safe and what is not when it comes to contaminants and protein quality and all that stuff. We are not here to clear the products based on what FSSAI says. Our projects were done just to show which is the cleanest. So most of these products may or may not clear FSSAI standards, but between them, we wanted to look at what was the cleanest. So we are not here to claim what FSSAI standards tell us. We are here to, like other people do. There are a lot of other third-party certifications and verification groups on YouTube. They clear the products based on what FSSAI says. We are not doing that. We are saying which is the cleanest that you can buy. That's it. The second Citizens Protein Project looked at our medical pharmaceutical protein products versus the nutraceutical, that is the fitness industry products. So what we identified in this particular second part study is that, and it's very important, that a lot of these nutraceutical, that is the fitness industry made branded and marketed products, they actually were of very high quality. So the initial mislabeling and all was completely taken care of, but that actually moved to the medical pharmaceutical protein products. For example, if you look at some medical pharma protein product, it had very low quality protein. It had very low quality of amino acids. There was rampant mislabeling, lot of adulterants, for example, fungal contamination, hormonal contamination, etc. And when you compared this with the fitness industry protein, like your common brands, they were excellent. And we proposed that even doctors prescribe fitness or nutraceutical grade protein products to the patients instead of medical pharma grade protein products, because even cost effectiveness was better when you use the nutraceutical or a fitness industry made protein. So at the moment, in my practice, I have changed the way I prescribe protein supplements. We have now stocked proper whey isolate, whey hydrolysate, and whey concentrate from nutraceutical companies in our hospital, and we prescribe the patients these high quality proteins. a minimum of 1 kilo to 2 kilo is available, and patients can actually consume this for over a month, sometimes even 2 months, depending on how much they are prescribed, and that actually saves a lot of money instead of buying those small 400-gram packets from the medical pharma company that they sell. So which brands are the good brands? I'm not going to take any names, but based on these two studies, we have made a list. I have made a list, and I will write down and I will mention that the list of good quality protein brands that we identified in the study in the description box under this video. You can just go through that and make a choice on your own, because I don't want to take names. I don't want to endorse any brands. So the final point here is that whey protein supplements are safe for use. They can be used as a good uh, protein supplement on a daily basis, even for the general population who are not able to target their protein requirements per day. And of course, especially for a very highly active person or somebody who's into fitness and sports and athleticism and athletics, bodybuilding, etc. Of course, whey protein supplements become a very important part of your routine. So fear not about whey protein supplements. If you choose the right brand, if you choose a good quality, pure whey protein, it's going to actually help you improve your lean mass, reduce your muscle breakdown, and also help you, promote a healthy lifestyle. Until next time, take care and have a great day.